Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we're broadcasting from inside Renaissance Bank in beautiful Alpharetta. And if you're looking for a bank that has been ranked in the top 10 of the United States by Forbes magazine, you would have come to the right place if you go to Renaissance Bank. Yep, they finished in the top 10 of customers surveyed nationwide for best banking experience. I have found that with my experience with Renaissance Bank, and if you want something different for your business, I suggest you go to renaissancebank.com and find their local office and give them a call, and I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Dr. Ricardo Duran and Debra Gonzalez. And Dr. Duran and Debra are with Wellstar North Fulton Wound Care and Hyperbaric Center. That's a mouthful. Dr. Duran, Debra, thank you so much for being with us.
Well, thank you for having us.
Absolutely. So let's talk a little bit about how you're serving folks here at the center. And let's describe what you do.
Well, first of all, thank you for your invite.
Sure.
And yeah, we're at North Fulton Hospital. We run the wound care and hyperbaric medicine department. It's an integrated service on the inpatient and outpatient setting, in which we manage complicated wounds, and we provide hyperbaric services for the approved indications. And for both inpatient and outpatient settings.
Before we define hyperbaric, which I know people want to know, describe what we're talking about with a complicated wound. What is that? For those that don't have it, they don't know.
Exactly. So in most cases, our system, our bodies are equipped on trying to heal themselves, depending on the level of the damage or the injury. If it's a minor injury, that's something that our skin would be able to repair itself. And most of us, like if we have a little cut or anything, if it's small enough, it will heal on its own. But some other cases in which deeper layers or more type of damage occurs, it goes beyond of what our mechanisms of self-repair can do. And that's when the tissues need some help, right, on a more specialized way to try to improve the conditions to reach full healing. And in most cases, those complicated wounds can really take a downhill on worsening that can actually lead to hospital admission or further complications, and in some cases, bad things like amputations. And also for those complicated wounds, it's not just about the fact of closing a wound. It's also how you close the wound, the type of tissues that come up to fill the defect. It's not the same if a struggling wound ends filling up with the defect with scar tissue versus on a more controlled way, as we do it at the wound center, in which we pretty much mimic the normal conditions of the tissues to guide full regeneration of those tissues. So the repair goes more similar to the original tissues instead of a full scar. And by scar, I'm not just talking about the aesthetics. It's the materials of the type of tissues. A wound that closes under those bad situations is more likely to reopen, had more complications, pain, infections down the road that will give more trouble to the patient.
Yeah, this is just my layperson's way of thinking about it, but when you talk about scar tissue, you're talking about something that whereas opposed to the way your skin feels normally, if you have a callus or something like that feels different, right? It's got a different character to it, and scar tissue is something somewhat similar, right?
Exactly.
Yeah, that makes perfect sense. So hyperbaric medicine, you were describing what the root words of that are, and that made it pretty simple. You were describing that before we came on the show. Talk a little bit about that.
Sure. Unfortunately, hyperbaric therapy is little known in the community, and I appreciate the fact that you're giving us the option to actually talk about it and teach to the community about what it is, because it's a quite important and underused tool to help heal patients. So hyperbaric oxygen therapy, and if we go down to the Greek roots of the word, hyper means high, baric means pressure. So when we put the whole thing together, hyperbaric oxygen therapy, what it means is a therapy in which we use oxygen at high pressure to achieve a goal. The goal that we're looking for is healing. The way biology works for mammals, and we, in essence, human beings, we are a form of mammals. Our tissues use oxygen to function for everything. In essence, the oxygen at the cell level becomes kind of like the currency. If the cell has enough energy and oxygen, they can do all the functions they are meant to do, like whatever specialized function that cell has, or even replication, especially that function of replication demands a lot of oxygen. So when the cells need to replicate to heal, they go to the budget manager and say, well, how much do we have? If there is not enough oxygen, then that function or that task is not going to happen. So in many cases, chronic wounds get stalled because of lack of adequate oxygen availability. That happens to diabetics, that happens to patients with radiation injury, that happens to patients with a lack of arterial flow in case of arterial insufficiency and atherosclerosis, kind of things. So what we do is we try to solve that critical obstruction, which is the lack of oxygen availability. When we put patients inside a hyperbaric chamber, they breathe oxygen at high pressure, and that pretty much bypasses and solves the problem that was keeping everything from functioning. Normally, right now, you and I, we're breathing air. So the composition of the atmosphere on this planet, air, only has 21% of oxygen. And it has the pressure that the atmospheric pressure provides. Both that pressure and that concentration of oxygen is not enough to drive that oxygen to be dissolved into the blood. So that's why evolutionarily we developed the hemoglobin to literally, it's a smart molecule that catches the oxygen in the lungs when we breathe in, and physically travels through the blood and delivers it to the tissues. But if we can actually just saturate the blood, the liquid with the oxygen, and we can do that by altering those two variables, pressure and concentration. And we do that in the hyperbaric conditions. We put high concentration of oxygen, which is 100%. That's not air. It's 100% oxygen at a higher pressure than what the atmosphere has. Could be 2 times the atmosphere or 3 times the atmosphere pressure. That's what we call atmospheres in the hyperbaric lingo. So by increasing the pressure and the concentration, we drive that oxygen to be fully dissolved into the plasma. And it goes everywhere by continuity, even in the areas where the blood vessels are not so good. So those areas that we're not getting enough oxygen is like if we were supplying it, if the highways are closed, we're supplying it directly with drones, for example, because it goes there and those tissues finally can get that breath of fresh oxygen directly to unstuck the situation. And in most cases, that is the reason for failure to heal.
Yeah, that makes sense. Folks, we're here chatting with Dr. Ricardo Duran and also Debra Gonzalez. And Dr. Duran, Debra. They are with Wellstar North Fulton Wound Care and Hyperbaric Center. I want to shift gears. I want to dig deeper into some of what you had to say, Dr. Duran, but I want to talk to both of you about your backgrounds and what makes you passionate about this work. Let's start, Debra. Let's start with you.
So I'm a registered nurse.
Mm-hmm.
I got into hyperbaric medicine, about 30 years ago. I was a commercial diver, not commercial, but a recreational diver. And it just kind of flowed because in hyperbarics, we also treat divers that get the bends. So we use it for that as well. And so it was just one of those things that I just fell into and absolutely loved. And what I love about it is that you get to see the dramatic results, the improvement in the patients that we treat. Myself, I've been a patient, and I can tell you that it's just one of those things that as a nurse, when you get to see someone improve and you get to see someone heal, it's why you do what you do. It's just the love of that.
That's awesome. And Dr. Duran, you've got diving in your background as well.
That is correct. Well, I'm originally from Colombia, and I was in active duty in the Navy, the Colombian Navy. I was in active duty for about 9 years, in which actually I was a military diver as well as recreational diver. But in my practice as a military physician, I was involved in the medevac program with the Marine Corps, the Colombian Marine Corps, and I was assigned to battleground. We had an internal conflict down there, and my intervention had to do with a lot of combat wounds. Lots of patients that were casualties of the war, many of them with wounds from bombs, and we had a lot of patients with lost limbs that I had to deal with and evacuate. So that seeing all this young patients losing limbs, that created a big commitment on trying to prevent that from happening. I was also dealing with a lot of acute combat wounds that also triggered my interest in doing better and learning more on how to improve the lives and quality of life of these people. In my diving part of my training, I was also introduced to hyperbaric therapy, mostly around the cases of bends with the Navy, which is the decompression sickness and treatment of the divers. So at the end, in my career, I found that the field of hyperbaric oxygen therapy and wound care actually brought together my full background of what I was doing, or what life put me the path to get into. So that's why through wound care, like managing patients with diabetic ulcers, on cases that would end with devastating amputations with those chronic wounds that are, if they're not treated well, they are going to lose their limbs. To actually develop a program that we're very proud at Wellstar North Fulton, which is the amputation prevention program, and that's that background of those phases of the ones in the war that actually lost their limbs, or now we're trying to prevent that, for that to happen to our patients now.
Sure.
Different conditions, but same result if they're not treated adequately. So through an adequate holistic program in wound care and hyperbarics, we're trying to prevent amputations and improve the quality of life through teaching, improving the nutrition, offloading, and the management of their chronic conditions to prevent this from happening again, and prevention of the amputations.
Yeah. So, Debra, I know you run the outpatient side.
Yes.
Let's talk about maybe the distinction between inpatient and outpatient care and how that breaks out?
So our outpatient center at Wellstar North Fulton is a community-based physician practice, meaning that we are just like a physician's office. This is Dr. Duran's office. We see outpatients. Anyone can refer themselves to our clinic if they have an open wound and need an evaluation. We're open Monday through Friday. And what makes it really good for the community is that there's a lot of education that we provide them on how to, once we've healed their wound, how to prevent it from occurring again. Just really basically, it's a physician practice that we provide to the community.
Terrific. Now, Dr. Duran, you mentioned uniqueness of the program. Let's talk about why the program is so unique here in North Fulton.
Yeah, actually, there are several things that sets us apart from other departments. The fact that it's integrated, the inpatient and the outpatients, we actually can start the evaluation and management from the hospital bed, and start a full plan of treatment that goes beyond of the discharge. Those patients get linked to the plan that has already been started from the beginning, from their admission, establishing a continuity of care. On the other hand, we follow strict guidelines, both in wound care and hyperbarics, which has resulted in the recognition of the governing bodies from both wound care and hyperbarics. More specifically, the UHMS. The UHMS is the Underseas and Hyperbaric Medical Society, which oversees all the hyperbaric facilities. And
this is a certification, correct?
That is, yes.
Okay. And this is a pretty unique thing, right? I mean, in certainly in North Fulton.
That is correct. And there are many hyperbaric facilities throughout the country, throughout the world. Yeah. Different levels of care. The UHMS, the Underseas and Hyperbaric Medical Society, evaluates the quality of care to see if they can get to the standards of care. Currently, around 1,700 facilities in the United States have been evaluated and have the certification through the UHMS. Only 49 currently have a certification with distinction. And our department at Wellstar North Fulton Hospital probably is one of those unique 49 facilities in the United States.
49 out of 1,700.
That's correct.
That's pretty thin air.
And actually 1,700 certified by UHMS. There are more.
Oh, okay. I got you. Okay.
Yeah.
Wow.
So it's the top of the top.
Yeah.
Which means all this ultra specialized surveyors, they came, they evaluated everything we do. Not only from the medical practice standards, but also from the safety standards, from all the other services that we provide, including, as Debra was mentioning, education, community outreach, prevention of recurrence. So pretty much it's not just we heal you, okay, you're out. No, it doesn't stop there. It's a more holistic approach. And that's when the UHMS actually found out that we went above and beyond in our efforts, and not only to treat those cases effectively and efficiently, but also to educate for prevention and prevention not only of recurrence but also from worsening conditions.
Wow.
Yeah.
Go ahead, Debra.
What I was going to add to that is that what also sets us apart is the majority of the staff at our wound center have gone above and beyond for certification. So it's not just having your RN, but it's also being certified in hyperbaric medicine, being certified wound care nurse. And so you have a level of expertise that you don't have at most centers.
Yeah.
So if your entire staff has gone above and beyond for that certification, you have the whole staff that are experts.
Yeah. Wow. That's fantastic. So it's not, so what you're saying, it's not just the facility, it's all the staff.
It's everything. Yes.
It's from soup to nuts.
Yes. It's everything. Yeah.
Wow.
Yeah.
Wow. That's, what great work. So, I'm curious about, and this may seem like an obvious question, but sometimes obvious questions need to be asked, is how do you know you need to get this kind of treatment?
That's actually a very important question because a lot of people don't even know about the existence of wound care centers.
Right.
Most people think, I have a wound, it will heal. But once they realize, like, no, this is a little more complicated, is causing problems in many cases at the level that they get admitted to the hospital. And that's what I was telling you about how patients get enrolled in our care. It could be either from the inpatient scenario, in which the wound got so bad the patient had to go to the emergency and got admitted. That's when we get involved in their care. So that's beyond the patient's control, because that's when they get to the hospital, and that's the benefit of North Fulton, that we do offer that service, and that doesn't happen everywhere. Now, on the outpatient scenario, patients can reach out to us directly by calling our department, or they can get referred by their primary care physicians or specialists that would be taking care of them. The benefit of that early referral with those complicated wounds is that the sooner we start the treatment, the more likely the improvement and the wound will close sooner. One of the benefits is in that first encounter, that first evaluation, we run a very strict, full, holistic medical evaluation to see what are the factors that are preventing this wound from healing and trying to actually fix it. And that implies not only things like infection, but also the nutritional status, see what of the medications the patient is already taking might be playing a role on that. What other things that patient might not be even aware of, like arterial insufficiency. Maybe the wound is not healing because the arteries are closed, or maybe the heart function is not that good, and they go for a wound in the foot. And they go out with a full cardiac evaluation, with an echocardiogram, with the chest X-ray. All those things actually do have an impact in that full evaluation of what is causing that wound. Things that patients are not even aware, like sleep apnea. Like, what does it have to do with a wound? But actually, it does. Patients with sleep apnea that are not having enough oxygenation overnight. Most of the damage is happening at night while they're sleeping with low oxygen tensions. So that's just one example of the many medical conditions and assessments needed to heal a wound. So that's why I'll take advantage of this exposure that you're kindly giving us, to let patients know that they can reach us directly if they are struggling with an open, complicated wound that has not achieved healing, and we can see them and offer our help. We can be reached directly. Our phone number, which is 770-751-2830. You can reach out to us and get an appointment. We're located in the first floor of the Wellstar North Fulton Hospital in Roswell.
Right on Highway 9.
Yep.
Awesome. Dr. Ricardo Duran and Debra Gonzalez, and they are with Wellstar North Fulton Wound Care and Hyperbaric Center. Wow, this has been both informative and fun, and I've learned a lot, and I know our listeners have. Thanks to both of you for coming in, and congratulations to you on this success and this certification that you received.
Thank you very much for having us.
Thank you very much.
Absolutely. Hey, folks, just a quick idea for you. If you're looking for a better way to celebrate your team and create a team building experience, one that involves where you don't have to go to Wellstar and get get those ankles taped up or bones put in, arms and legs put in a cast. Here's an idea for you. A&S Culinary Concepts. They've got an award-winning culinary studio in Johns Creek, and yeah, they do corporate catering and all that kind of stuff you would expect, but they also do corporate team building, and it's a lot of fun to stand around, because I've been there. It's a lot of fun to stand around a stainless steel table and season meat and cut up vegetables together and then enjoy what you've cooked together. Call Executive Chef Andrew Traub over there, 678-336-9196. Or if you want more information, go to asculinaryconcepts.com and let Andrew know that we sent you. And folks, just a quick reminder, North Fulton Business Radio, we're coming up on show number 500. It's in our sights. And we've been here on broadcasting for over 6 years now, celebrating great business and community leaders like Dr. Duran and Debra. And we would love it if you would share the show. If you've heard something here that you think others could benefit from, share the show, because that's what we're all about, is celebrating the work of leaders, great leaders like all these guests that we've had on the show for these many years. So for my guest, Dr. Duran and Debra Gonzalez, I'm John Ray. Join us next time here on North Fulton Business Radio.